Hey everyone, welcome to Nurse Doc Tutoring. So I am Asia, the Nurse Doc, and today's lesson is hypoglycemia and hyperglycemia. What to do if your patient is experiencing this. And this is going to be on a fundamentals level. So I'm not going to dig into the med surg part, but this is going to be for my fundamental students. So if you know someone who is struggling to understand hypoglycemia or hyperglycemia, share this video, like this video, so your classmates can learn and be successful on their exams as well. Alright, so what is the normal level for your blood glucose? So your blood glucose level should be 70 to 100. So this is really important that you know the normal range. Alright, hypoglycemia will be below 70. So what are some signs and symptoms if a patient is experiencing hypoglycemia? So the patient will be sweating profusely. They will just be laying in bed and they will be covered in sweat. The patient could be irritable. The patient could complain of being excessively hungry. The patient could even be drowsy, have a patient all of a sudden they're just so sleepy, lack of coordination. The patient also could be shaky, have the shakes. So these are signs and symptoms of hypoglycemia. But remember, each patient could present differently. Alright, so what to do after you have assessed your patient and see that they have signs and symptoms of hypoglycemia. So first you want to get a blood sugar reading to confirm those symptoms, okay? So that's the first thing you must do is get an actual reading. So if the reading is between 55 to 69, we're going to treat it with the 15-15 rule. So what is the 15-15 rule? So after we take the patient's blood sugar and it's in that 55 to 69 range, we can give them 15 grams of carbs. So 15 grams of carbs could be 4 ounces of juice. It could be a tablespoon of sugar, honey, or syrup. It could be some hard candies, and you will have to look on the back to see how much that patient will need to eat of those. You could give them 3 to 4 glucose tablets, or you can give them 1 dose of glucose gel. So you want to give one of those options, and then in 15 minutes, we want to recheck that patient's blood sugar again. If it is greater than 70 or greater, then good. We brought the patient's blood sugar up. But if it's still below 70, we want to do it again. So we would then give the patient another 15 grams of carb, and then in 15 minutes, we would check it again. So you would do that until the patient's blood sugar increases above 70 or above. Or depending on the hospital that you work at and their order sets, they may allow you to do this 3 times before they actually want you to call the doctor and get another order for something else. So you want to just make sure that you follow protocol. But remember the 15-15 rule, that we're going to get 15 grams of carbs, and then in 15 minutes we're going to check that patient's blood sugar, and if it's 70 or above, then we're good. If it's below 70, we want to do it again until that patient's blood sugar gets to the normal range. So hyperglycemia is a blood glucose level of 125 or higher. So even though the patient's blood sugar is considered hypoglycemia at 125, we usually don't start treating the blood sugar until it's 150. And each patient varies of when the doctor actually wants them to start getting treated for that hypoglycemia. So what are some signs and symptoms of hyperglycemia? We got headache, we got nausea, we got vomiting. If the patient's blood sugar is really high, they can end up in a coma, they can have dry skin, and they can have glucose or acetone in their urine. So what are we going to do if a patient is experiencing hypoglycemia? We must have a medication order for insulin. So we can't just go around giving people insulin just how we were able to go around and give the patient the orange juice, right? Or give them the hard candies. In order to treat hypoglycemia, you must have an order for insulin. And you need to keep it just simple like this, because we are on the fundamentals level, that you would give insulin as ordered for hypoglycemia.